If you're in the medical field or simply fascinated by ECG patterns, stick around as we dive into the fascinating world of the De Winter T-wave. Let's get started. What is it? The De Winter ECG pattern is a critical finding often referred to as an anterior STEMI equivalent. Unlike traditional STEMI presentations, it appears without the obvious ST segment elevation. These patients are experiencing occlusion myocardial infarction, or OMI, which requires immediate reperfusion therapy to restore blood flow and save heart tissue. Now, how do we recognize it? Here are the key diagnostic features. Tall, prominent, symmetrical T-waves, usually in the precordial leads V1 to V6, but especially in V4 to V6. Upsloping ST segment depression, greater than 1 mm at the J-point, is seen in these leads. Notably, there's an absence of ST elevation in the precordial leads. You might spot a reciprocal ST segment elevation, typically subtle, about 0.5 to 1 mm in lead AVR. Interestingly, this pattern can appear before or after typical STEMI morphology.
Why is the De Winter T-wave important?
It's observed in approximately 2% of acute left anterior descending artery, or LAD, occlusions. Unfortunately, it's often under-recognized, which can delay life-saving treatment. This high-risk ECG pattern highlights the need for urgent intervention, often involving invasive strategies like PCI or thrombolysis. Let's take a look at two examples to solidify our understanding. Example 1, we see upsloping ST depression in the precordial leads, more than 1 mm at the J-point. There are prominent anterior T-waves, especially in V2 to V6, with the ascending limb of the T-wave starting below the isoelectric baseline. Lead AVR shows a subtle ST elevation of over 0.5 mm. Example 2. Here, De Winter's T-waves are paired with features of anterior STEMI, indicating an acute proximal LAD occlusion. Upsloping ST depression and peaked T-waves dominate V3 to V6. Additionally, there's ST elevation in the septal leads, V1 and V2, high lateral leads, I and AVL, and reciprocal changes in the inferior leads, consistent with LAD occlusion near the first diagonal branch. In summary, the De Winter T-wave is an essential but often under-recognized ECG pattern signaling acute myocardial infarction. Recognizing it promptly can make the difference between timely reperfusion therapy and devastating outcomes for patients. If you found this video helpful, don't forget to like, subscribe, and share. Drop your questions or comments below. We'd love to hear your thoughts. Stay tuned for more insights into ECG patterns and emergency cardiology. Thanks for watching.